Hi, my name is Bern. I'm going to be talking about the unscheduled documentation. Over here, we're here at the patient desktop, and this is where the little house and the person icon is to get to this page. On the left side, you're going to see your patient shortcuts. You're going to find unscheduled documentation, and when you click on it, it's going to navigate you to this page right here. You'll see a lot of items here listed, but each group of items are broken down by different categories, such as interventions. You'll see that you'll have your glucose, your physician with your S-bar, comfort measures, dressing changes, etc., even a central line dressing change as well. Down here, you're going to see some assessment items, such as your system assessments, your vaccine information, also a sepsis screening tool, your anxiety assessment, falls risk assessment, and a pain assessment. Right here you have your vital signs. It even has the individual vital sign to be assessed if you need to update a temperature, pulse, respirations, or blood pressure. As you continue scrolling down, you'll notice that you have your admission stuff, such as patient belongings, transport, change of status, change of attending physician, even an AMA section. And then the rest are different departments, such as the transitional care unit and the acute rehab unit. These are more specific to these departments. So now that we're here on the unscheduled procedures screen, I'll be going over a few examples just to give you an idea of how things are documented here and what this unscheduled procedures are usually used for. For example, if you need to update an allergy, you simply go to your unscheduled documentation and it's the first one on the list. So we're going to do an allergy update. So I'm going to go ahead and select this item right here. You just click once, then you click OK. After that, you want to make sure you pay attention to what the transaction line says on the bottom. Enter date and time when unscheduled procedure was performed. In this case, if you're updating the patient allergy right now, you just leave it as is, click OK, and then you want to look at your transaction line. It's asking you to choose option. And here you have document and then verified. Verified means that you have verified the allergies with another department. For example, if the patient came from the emergency department, they gave you the patient allergies and it's already documented, you can just click verified. But in this case, you want to update the allergy. So you want to click document. And then here in this case, it's going to ask you for an allergy bracelet. You just want to click yes because we need to apply the allergy bracelet for the patient. And then you want to find the right field. For example, if you want to add that the patient is allergic to Tylenol, you just click on this box right here. After you click there, the transaction line is asking you to select option to edit or choose option. In this case, we want to add an allergy. So you want to click this one right here, document another medication allergy. So you want to click once. And then it's asking you to select medication name or enter medication name, partial words, or choose option from this list. So in this case, you can actually type Tylenol. I usually type in the first few letters and then put a dash and then click OK. So now you have a list of different Tylenol. I'm going to go ahead and select this one, so I'm going to click one time and then I'll click OK. And then it's going to ask you the primary symptoms of this medication when the patient's experiencing an allergic reaction. For example, if the patient is itching or develops rashes, you can select this one, itching, and then also a rash if the patient develops rashes. Then click OK. Now here it's asking you for a reaction type. You want to select here from the different options. You have your allergy, adverse reaction, intolerant, insensitivity. Otherwise, there's an unknown selection here. In this case, we're going to select allergy, and then severity. It's going to ask you whether it's mild, mild or moderate, moderate, moderate to severe, or severe. In this case, we're going to say that this patient has a mild, moderate reaction to Tylenol. So you click there once, and it's going to ask for the onset date. So the transaction line is asking you to enter the estimated date that the allergy began. Let's just say it began yesterday. So you want to type in T for today, and then dash or a minus, and then 1 for yesterday, T minus 1. And then you want to click OK. And then it's going to ask you about who informed the information to you. So in this case, you want to select patient. And you want to click OK. And then after the fields have been filled out, you can click OK. And if you need to add any more allergies, you just simply click this one and it'll go through the same process. So in this case, we don't need to add any more allergies, so we're going to click OK. And if there's anything else that needs to be changed, such as the latex and food and substance sensitivity, you simply do the same thing and click on the field and then click OK. In this case, there's nothing that I need to update, so I'm going to click OK to take me to this next screen. And to save it and to file it into the system and have it updated, you want to click Accept. So my allergies have been documented and it should be updated soon. Okay, next we're going to be talking about Ticket to Ride. Ticket to Ride is a sheet that you must fill out, especially when the patient gets picked up for procedures. For example, let's do a procedure for an abdominal ultrasound. So you want to go back to your unscheduled documentation, and then here you will find Ticket to Ride on number 9. So I'm going to go ahead and click there one time and click OK. Again, it's asking for the date and time, so you want to click OK. And now it's asking for a procedure. In this case, we're going to type in abdominal ultrasound. And then you want to click OK. Now it's asking for procedure. So I'm going to type in pain, nausea, and vomiting. I'll go ahead and click OK. Now it's going to ask you if the patient has been NPO since midnight. So I'm going to click yes. And now it's asking me if the patient has been medicated for pain in the past 12 hours. So in this case, let's say I gave the patient some pain medication. So I have to select yes. Next, it's asking me for the date and time of the last pain medication. So let's say I gave it around 8 o'clock this morning. So I'm going to type in 0800 and I'll click OK. Now it's asking me if the patient is a fall precaution patient. So I'm going to select yes. And now it's asking me for the vital signs. So I'm going to click Document Vital Signs. And I'm going to go ahead and fill out the appropriate fields. I'll click OK after I fill out each field. Okay, after that's all been filled out, I'm going to click OK. Now it's asking me for oxygen therapy options. In this case, I'll select a room air, so I'll click once. I'll click OK. Now it's asking me for the level of consciousness. I'm going to select 1, patient's alert, click OK. And now on the bottom, it's asking me to choose option. So I'm going to click accept. So now it's filing. Once it starts filing, it should automatically print out. Once it's printed out, you need to make sure you sign on the signature part and then hand it to the transporter with the chart. I'll be going over another couple examples.